Good day, everyone. This is Oyekole Abdullahi Andrew, C.E.O. Criterion Trado-Medical about home and founder of Criterion Life App. All praise belongs to God Almighty, the one whom by His pleasure, whom by His mercy, all good deeds is being accomplished and achieved. I glorify God Almighty and I appreciate Him for His endless blessings upon me. Today, I'll be introducing to you 3 of our newly launched books and also our application, which we just designed and for the benefit of humanity at large. The first book which I'll be introducing to you is a book titled 100 Medicinal Properties and Plants with Each Properties. In the book, we discussed on what are the therapeutic properties, what are the medicinal properties, what are the actions that we want to derive from making use of some herbal regimen. All health issues have symptoms and signs which they show. Some health issues are characterized by pains and inflammations. Some health issues are characterized by insomnia. Some health issues are characterized by diarrhea, bloating, and other symptoms. And each of these symptoms, each of these signs have ways to regulate and address them. Herbal medicine, natural medicine, is an ancient form of treating which have been in use since the beginning of time. The book before me, 100 Medicinal Properties and Plants with Each Property. In this book, I discussed on 100 therapeutic actions like anti-inflammatory, antimicrobial, antidiuretics, bronchodilator, hepatoprotective, neuroprotective, nephroprotective, 100 of these therapeutic actions. I expatiate and I discussed on what does it mean when a herb or substance or plant or drug is said to be anti-inflammatory as a case study. What does it mean when your doctor or your physician tells you to make use of antibiotics? What is antibiotics? What is it used for? What are the medicinal compound properties present in these antibiotics that can make it to give that desired result to address bacterial infections? So I discussed at length on this. Then I now discussed on what are the health issues that can necessitate the usage of each medicinal properties. For example, Zingiber officinal is an herb that possesses anti-inflammatory property. What does it mean if we said ginger possesses anti-inflammatory property? What health conditions can necessitate the usage of herbs that possess anti-inflammatory property? Then after I discuss on this, on the health issues that can necessitate the usage of these medicinal properties, I now make mention of 20 well-researched upon plants that possess each properties. You know, I discussed on 100 medicinal property, 100 of them. This is the book here. And in the table of contents, so we have anti-inflammatory, antioxidant, antimicrobial, antiviral, analgesic, antifungal, antiseptic, diuretic, antispasmodic, sedative, expectorant, immune stimulating, adaptogenic, anti-allergic, anti-cancer, anti-diabetes, anti-arthritis, antipyretic, anti-anxiety, anti-ulcer, cardioprotective, hepatoprotective, neuroprotective, wound healing, antithrombotic, 100 of these properties. So after discussing on each property and discussing on the health issue that can make you to make use of any of these properties, then I now outline 20 plants each that possess these properties. From the chapter 1 to chapter 20 of the book, that's first 5% of the book, I recommended just 20 plants each. But from the chapter 21 to the 100, I recommended 30 plants. That is 30 plants that have these properties. And the reason for this is perhaps you might not find these plants in your location, but you might find this. You might not find this, but you might find that. And these same plants also possess this therapeutic action. Then after I outline the plants that possess these medicinal properties, I now explain how do we formulate these herbs? Which one do we cook? Which one do we infuse? Which one do we make tincture? That is, which one do we use vinegar to tincture? Which one do we use in powdered form? Which one? So I discuss on how you can formulate them, how you can combine them together, because some herbs, they are best used when combined. So which of the herbs do you combine? Which of the herbs do you use separately? So these are part of what is being discussed in this book before me. The book is a 572 pages book. Then after I discussed on the 100 medicinal properties, another chapter was dedicated to discussing 135 plants. I discussed on 135 plants, their botanical names, their English name, the Yoruba name of the plant, the Hausa name of the plant, and the Igbo name of the plant, so as to maximize the benefits that we can all get from the plant. If you are in Nigeria, these are the major tribes in Nigeria. Now, and with this, if you are in the West, that's in the western part of Nigeria, it's easy for you to get any plant that is recommended in this book, because the names of the plants have been written out in Yoruba language. If you are in the northern part of Nigeria, that is where the tribe that dominates the northern parts are the Hausa Fulanis, then the names of the plants that are recommended in this book is also in Hausa language. Also, if you are in the eastern part of the country, there are plants, 135 plants that are written out in Hausa Igbo language, which will also make it easy for you to get the plant. Then after that, in the last chapter of the book, we discussed on 40 plants. We discussed on 40 plants. And in during the discussion, we discussed on what are the medicinal compounds, what are the medicinal therapeutic actions that these plants can give us if we should use them. What do we expect if we should make use of Moringa oleifera? What are the therapeutic actions that it can, it possess? So I discussed on 40 plants like this, 40 common plants, and that is what we have in this book. And I would love to add this. Each information in the book, documented in the book, are well researched upon. They are not just written, maybe just based on my experience, my personal experience. No, they are gathered from different reliable sources. Extensive research work was being done to bring this to life, and we will love everyone, most especially lovers of nature. I call it a treasure to all lovers of nature. If you love natural medicine, if you are interested in the practice, or you are already a natural medicine practitioner, then having a copy of this book is one of the best decisions you can make for yourself. Because having this book with you, and also let me add this, I added a disclaimer in the book, because health is a very broad field, which means it is not ideal that you always take your hands into your control, like you try to always address your health conditions yourself. So, but if you are a healthcare provider, having this book is an additional boost to your professionalism. You have a patient, the patients have some health conditions, and the patient is having some symptoms, maybe inflammation, maybe pains, maybe swelling, maybe there's a wound. In the book, you can get, extensive explanation on plants that you can use to treat or manage or control the symptom that the patient is seeing. You have a patient having hepatitis, have a patient having nephritis, having hypertension, having diabetes, different health conditions. So understanding what are the therapeutic actions or what are the medicinal herbs that can be used and why do you use them? What property do they possess that will make you to use them? So this is what we discussed in the book. So we are telling you this, and what we want from you guys is that we want this book to go far as much as possible. We want everyone to have a copy. It's a book that deserves to be in every home. We have so many reviews from different professional healthcare providers. So we want you guys to get a copy of the book. We send, we can deliver within the country and outside the country, and we also have a copy. We have the book is already on Amazon. So to get it on Amazon, we will include the link on the screen. So please get the book and also help us to tell people about the book. Let them know about the benefits in the book, and that's what we want from you regarding 100 medicinal properties and plants with each property. Secondly, the book which I'll be introducing to you secondly is a book which I titled The Ultimate Married Men's Guide. The Ultimate Married Men's Guide. One of the constant problems we have in the society is that men have problems regarding being able to satisfy their woman doing sexual related activities. There are so many health conditions that affect some men that prevent them from being able to be diligent doing sexual relationship with their wife. Now in this book, I explain and discuss extensively on each problems that can hinder a man, that can prevent a man from being sexually active with his wife. I discussed on psychological problems, biological problems, chemical problems, physical problems, and other problems that can affect a man and that will affect his, sexual prowess, that would disturb him from being sexually responsible with his wife. And this is very important because sexual dysfunction is a major cause for broken home. So many homes have broken, so many marriages have ended up in divorce, and one of the major causes behind this is inability of the man to diligently, give his wife what she deserves. That is sexual satisfaction. So having a copy of this book is a solution to basically all sexual related problems. So I encourage you guys to get a copy of the book. It gives solution. It explains extensively all what you need to know about sex. Also in the book, I discussed on sexual compatibility. And the reason for this is simply that some people are into marriage. They felt, I love her, she loves me, and that's good. That's one of the basic rudiments why we go into marriage. But there are some times whereby you as a man, you know yourself, you know your strengths, and you also know, the size of your genital, you know how best you can perform. So with this, there are some informations, there are some orientations that is quite necessary you have best before going into marriage. So you know the best kind of woman to get married to based on the size of your genital. Because some people go into marriage and after some few months, after some, few period of time into the marriage, they start having series and series of issues. Some will start calling their healthcare provider, please, I need some herbs to use to boost my size. I need some herbs to use. I need some cream to use so as to increase the length of my genital. So, and what's the reason behind this? Because their wives are complaining. So, but before going into it, if you understand and have some basic knowledge, some basic orientation about sexual compatibility, you would have known what kind of woman would be best for the size that I have. So this is based on research. This is based on extensive. It's not just a maybe I think, I thought, I imagined. It is based on scientific research. So it's a very interesting book, and I recommend that you get a copy of the book. And so that's that. The third book, which we would be launching, the image will be shown on the screen. So we name it Simplified Approach to Disease Diagnosis and Patient Result Interpretation. The inspiration behind this book is brought about the desire to orientate most of natural medicine practitioners. The primary targets for this book are primary healthcare, natural medicine practitioners who are part of the primary healthcare system. Most naturopaths, most natural medicine practitioners, we don't have in-depth knowledge on disease diagnosis. We don't really understand how do we diagnose patients' condition. We generalize. There are some symptoms that some patients exhibit that are generally common. And these symptoms should be addressed based on the underlying factor. But because we don't really understand how to diagnose, what are the tests to recommend, how do we interpret the test result, so we most time make mistakes in this regard. So I wrote the book. It's a 120 pages book, Simplified Approach to Disease Diagnosis. In the book, it has two major chapters. In each chapter, in the first chapter, I discussed on 12 body system. Our body is divided in region and in system. I discussed on 12 body system, like the digestive system, reproductive system, lymphatic system, immune system, respiratory system. So I discussed on these systems. After discussing on the system, I discussed on health condition, 20 health conditions that affect each system. 20 most common health conditions that affect the digestive system, 20 most common health conditions that affect the reproductive system, 20 most common conditions that affect the immune system. So I discussed on 20 diseases that affect each system. Meaning, I discussed on 12 systems, then I explained 20 diseases each for each system. In fact, in some system, I discussed on 35 diseases that affect the system, based depending on the system. But at least I discussed on 20. In some system, I discussed 25. In some, I discussed 30. In some, I discussed 35 diseases. Then afterwards, I discussed on what are the tests and scan that you recommend to your patients to do. If your patient is having an issue in the digestive system, how do you diagnose? What test do you tell the patient to go for? What scan do you tell the patient to go for? So these are what I discussed in the first session. I discussed on the diseases in each system, and I discussed on the tests and scan to use to diagnose the problem in each system. Then in the second section, I discussed on 33 tests. 33 tests and scan. And the interpretation, simplified interpretation to each test. I discussed on MRI, I discussed on CT scan, I discussed on X-ray, I discussed on electrocardiogram, I discussed on biopsy, I discussed on urinalysis, I discussed on liver function test, kidney function test, semen analysis, female hormone assay test. I discussed on so many tests, so many scans, and explanation on simplified explanation that if a patient should come to you with this result, this is how to interpret it. This is how to analyze it. This is how to explain and get the desired result. In some, like when I was discussing on FBC, full blood count, in full blood count, so many parameters will be checked: the white blood cell, the red blood cell, the platelet counts, the hemoglobin levels, and the likes. I discussed on if it is high, what does it indicate? If a patient is having high white blood cell. That is, if the white blood cell level is high, what does it indicate? If the white blood cell is low, what does it indicate? So I discussed on this so that it will be very, very easy to understand the patient's condition. So this is the third book which we launched, and I encourage us all to also get a copy of the book. The book is sold for just 5,000 naira, and it can be delivered anywhere within the country and outside the country also. Lastly, we would like to tell us about our Criterion Life App, which is a one-stop solution to most life problem. I call it Life App because it caters for many life issues. Criterion Life App have so many features. Amongst the features on Criterion Life App is there is a section on the app where we discuss on medicinal plants. We discussed on over 500 medicinal plants and the description of the plants, the botanical name, English name, Yoruba name of the plant. We discussed on uses of the plants. How do you use the plant for medicinal purpose? How do you derive the curative actions from the plant? We also discussed on the side effects of each plant. This is a free app. It's on Play Store already. You can download it, share it to your loved ones, let them benefit from the app. It's a free app. You get the uses, you get the how to use it, the description, the curative actions, and also the side effects. Also, in another session of the application, we discussed on diseases, on so many common and non-common diseases. We discussed on the causes of the disease, how to prevent the disease, the symptoms, the types, the prevention of the disease. We also discussed on conventional medicine that can be used to treat, to manage, to control the disease. We also discussed on natural medicine that can also be used to treat, to manage, and to control the disease. We also discussed on dietary approach. We discussed on what are the dietary recommendations, the dietary restrictions that you need to abide with if you are having some certain disease. Like patients having hepatitis, patients having hypertension, what are the necessary food that they should inculcate, and what are the foods and drinks that they should avoid. So these are part of what we discuss on what we have on the application. We also have marriage and sex matters. There's a part of the application dedicated to marriage and sex discussions. We also have a part of the application whereby you can ask artificial intelligence basically any question. There's AI integration on the application. You ask any question and you get prompt response from the application. We also have a forum where we can chat, we can discuss, we can basically have different discussions on the application. So there are so many features on the application, and right now as we talk, right now as of today, we are working on launching the second version of the application, because we are always working and always trying to improve the quality of the application. So we are working on the second version, and with God's help and assistance, by June, latest July, we would launch the second version. And the second version will have so many other additional features. There will be in fact, the added features on the one we have already is over 60%. So we are rebranding the application, and what we want from you, the viewers, on the application, is that when anyone come up with a brilliant idea, a brilliant innovation like this, the best that we can do to appreciate the person is to speak out, to evangelize to people about that innovation. Help us to publicize. We want people to know about the app. It's a free app, but we want people to benefit from the app. We want people to know about the app. We want it to go viral, and we know we can't do that on our own. No matter the ads, no matter how, you can help us to do that. So we want you to assist us to reach out to so many people. Tell them about the app, share the app, so that's the first thing we want from you. And secondly, we need those that can invest in the application, those that can be a shareholder, that will own some part of the application. So there is a well-documented business plan on the application, and if you are interested in knowing about the business plans behind the application, you can reach me out on 090-123-67492. 090-123-67492. We need investors, and there is so many potentials in the application, and we we guarantee that with the help of God Almighty, we all, there is so many benefits, there's so many ways to generate income from the application. So if you are interested, as I said earlier, 090-123-67492. So in summary, if you are interested in getting this book, 100 medicinal properties and plants with each properties, the book is sold for 12,000 naira, and it can be delivered to any part of the world. Any part, I use the word any part. So if you're interested, reach me out on 090-123-67492. 123-67492. And the Ultimate Married Men's Guide, Be a Sex Legend, is sold for just 5,000 naira. And it can also be delivered to anywhere. And also the third book, Simplified Approach to Disease Diagnosis and Patient Test Result Interpretation, that is also sold for 5,000 naira and can be delivered to any part of the world. So this is sold for 2,000 naira. I name it Step-by-Step Journey to a Blissful Marital Life. It's on marriage, on what you need to know about marriage, how do you spice up your marriage, how do you improve your marriage. So it's sold for just 2,000 naira, and we will send it to anywhere within the country and outside the country. So this is what we have to say, and we really appreciate you for your time. Thanks so much, the Criterion Cares. Reach me out on 090-123-67492. Thanks so much.